You have a broken tooth and you want to know what you need to do to fix it or if it needs to be replaced. Getting a dental implant or a crown on a broken tooth is a big decision, and you should feel confident that you've made the right solution for your mouth. I'm going to walk you through 7 great questions to ask your dental team before making that decision. So the number one most important question is, what are my options and why is this option the best one for my mouth? Here at our office, we always walk patients through the options that they have to fix a tooth or replace a tooth. My treatment plan by nature tends to be very conservative. I always want to save teeth, and so that's where I start. If you have a tooth that's broken down and there's enough healthy tooth structure to restore it, by default, I'm going to want to restore that tooth. And sometimes that's more involved. Sometimes it will need a root canal. Sometimes it will need a buildup and then a final crown. But in my book, if I can restore that tooth and keep the tooth in your mouth, that's going to be the first option that I present to you. Unfortunately, a lot of times a tooth is broken down to the point where we can't save it. And at that point, we need to have the tooth taken out. And then we have a couple different options to replace that tooth. So a really good dental team is always going to give you the options of saving the tooth, not saving the tooth, and walk you through the different options that you have. Not only what's involved in each step, but also the price, the time range, and how long it's going to take to go from your broken down tooth to a healthy restored tooth. It's really important that your dental team explains to you what's going on with your mouth and what your options are. If you don't feel like you're being communicated clearly to what your options are, you need to get a second opinion. The second thing you should ask is, how long is this solution that we've decided to go with going to last? Different treatment options have different lifespans of how long that's going to last in the mouth. So while something may be a little bit more expensive on the front end, sometimes it's going to last us a lot longer. So there are lots of different options. You need to make sure that they clearly explain how long typically this choice of restoration lasts. So technically, crowns on natural teeth and crowns on implants are not guaranteed for life. Our goal is to have them last you a lifetime, but the mouth is a very rough environment, and so at some point in time, that crown might have to be replaced. So if you get a crown done when you're 30 and it does a great job until you're 55 or 60, I'd say that was a great investment. But just because it lasted 30 years and did great doesn't mean it's going to last another 30 years. It could, don't get me wrong, and that's our goal. We always aim to do one crown and have it last you a lifetime, but you just got to be aware that in the oral environment, nothing's guaranteed. Our goal is to have you keep it for a long time, maybe even forever. So the third question you need to make sure is clear is, how long is it going to take from the start of treatment until you get the finished final crown in your mouth? You know, one of the cool things we have now is the capability to do same-day crowns. So if the situation presents itself where there's enough tooth to save with a crown, a lot of times we can actually make that crown in one appointment. Same day, it takes about 2 hours, and you can leave with a final tooth-colored ceramic crown. Sometimes there's other work that needs to be done, whether it's a root canal before you can put the final crown on, or if the crown has to be sent off to the lab, you're looking at about 2 to 3 weeks of turnaround time where you need to have a temporary to kind of protect that tooth. Implants, while they're great, I love implants, they take a lot longer because we actually have to wait for the healing. So even though the tooth is extracted, sometimes we can actually place the implant that same day. You're going to have to wait about 3 to 4 months for the bone to actually grow onto the implant, and then another 3 to 4 weeks for the crown to be put on top. So sometimes you can go almost 4 to 6 months before you get that final tooth in your mouth. So the most important thing that you need to know is, how long is this process going to take? Because it can be very frustrating if you're not aware that you're not going to get that final tooth in your mouth for another 6 months. I always feel bad when patients come in and say, my goodness, this is taking forever. Why don't I have this tooth yet? And by being upfront about it at the beginning, a lot of times we can avoid that conversation because the patient knows, okay, this process is going to take 4 to 6 months, but when I get it, it's going to last me a lifetime. So question 4, and another necessary piece of information to ask, is, what material are we going to use to restore my teeth? In dentistry, we have a lot of options. So a lot of times the material we use depends on if it's in the back of the mouth or the front of the mouth. So in the back of the mouth, a lot of times we'll use gold, metal, or zirconia because it's a lot stronger. Towards the front of the mouth, we can get away with a little bit less stronger materials that are much more aesthetic. So ceramics, porcelain, sometimes zirconia as well. And the reason for that is because the back of the mouth is where all the action happens, is where all the chewing and grinding happens. So we need to use stronger materials that are going to last longer. So the teeth in the front of the mouth are all about aesthetics and looking nice. So typically speaking, we like to use porcelain and ceramic in the front because it looks nice. But if you want a gold tooth in the front, we can make that happen. While dental allergies are rare, that's definitely something to take into consideration. So if you have a dental allergy, let us know and we will absolutely accommodate that with different materials. So question number 5, and I know this is probably the biggest one in everybody's mind, is, how much is this going to cost me and will my insurance cover it? No one likes a surprise bill, and nothing can be more frustrating than thinking this is what it's going to cost you and that insurance is going to reimburse this much. So at our office, we always start with an upfront bill. You know exactly what the fees are going to be, and we'll also do our best to let you know how much insurance is going to help cover that cost. Before you leave, make sure your dental team gives you the total price of all your treatment. That's one of the things we really pride ourselves on here in our office, is that no one leaves without a complete treatment plan that lets you know the exact price and cost of everything up front, so there's no changes and no surprises. Question number 6, what happens if I decide not to do treatment? Is my tooth going to fall apart? Is my mouth going to break down? A lot of times it's just as important to know the risks of delaying treatment as to what your options are. Because if you're not aware that not treating this tooth can lead to further breakdown and damage for the rest of your mouth, you might think, oh, I can just wait a while and put off treatment. It's very important to be made aware of the risk of not treating that tooth. The seventh question that I would recommend you ask is, can I see some before and after photos? And any practice that's able to show you work that they've done in the past and walk you through what the teeth look like before and after is going to be a quality dental practice. At our practice, we've got a digital photo book that we can walk you through every procedure that we offer that kind of shows you, we've done this before, we know what we're doing, here's the outcome you can expect when we do this for you. Here's your take-home message. At the end of the day, it's your smile, it's your mouth, and I want you to be 100% comfortable with the treatment plan that's come up for you. Not 99%, not 92%. I want you to be 100% satisfied and know that this plan is right for you and custom made to you, and it's gonna be the best option for your mouth. Do not be afraid to ask questions. I personally love it when patients come in with questions. If you have a sheet of 20 questions, I love sitting down and going over each question with you to make sure that at the end of this, you leave satisfied and comfortable, because the happiest patients are the ones that know what to expect and get what they expect. So ask questions. If you have any questions, or if you want to come see us for a second opinion, click the link below, drop some comments. We'd love to have you come see us. I'm Dr. Brett Langston. I'm here to help you watch your mouth.
Down in Brookhaven, with a smile shining bright, Dr. Brett Langston's working late into the night. With hands steady and a gaze so keen, he's the best on thoughts, the dumbest you've ever seen.